For this research presentation, I decided to choose articles that dealt with drug abuse and drug addiction. And for the first article, the title of it is Effects of a Single Lyric Analysis Intervention on Withdrawal and Craving with Impatience on a Detoxification Unit, a Cluster Randomized Effectiveness Study. This was written by Michael J. Silverman, and it was published in 2016. For the summary, the study sought to measure the effects of a single lyric analysis intervention on withdrawal and craving with impatience on a detoxification unit. Also, another objective of the study was to determine if relationships existed between treatment effects and participants' familiarity with the song. There were 144 participants in the study, and they were all cluster randomized to experimental post-test only or waitlist control pre-test only conditions to provide treatment to all participants in an inclusive single-session design. The adjective rating scale for withdrawal and the brief substance craving scale were used to measure withdrawal and craving symptoms respectively. For the experimental group, after providing performed consent, they participated in a single group lyric analysis session and then completed the post-test instruments. For the control group, after providing informed consent, they completed the pre-test instruments and then participated in a group recreational music therapy intervention. For the results, although the withdrawal and craving symptoms of the experimental group were lower than those of the control group, the results were deemed not significant. The type of design that this was a group-based cluster randomized single-session waitlist design, which was quoted in Silverman's article, or also in broader terms, it's a quantitative design. The independent variable for this research study was music therapy, and the dependent variables were withdrawal symptoms and craving symptoms. Although the results of the study were deemed not significant, the experimental group still experienced a decrease in their withdrawal and craving symptoms in comparison to the control group. This informs clinical practice by suggesting a method of treatment that might work for individuals suffering from drug addiction and in a detoxification inpatient unit. As stated by Silverman, as medical professionals and detoxification facilities frequently utilize pharmacological interventions to reduce patients' withdrawal and craving symptoms, it may inadvertently reinforce reliance upon chemically induced cognitive, affective, and behavioral change. So basically, this is saying that the study suggests that using lyric analysis can have a positive effect on individuals going through the detoxification process without necessarily having to rely on medications to help them through the detoxification process. For the second article, the title of the article was The Effects of Group Improvisational Music Therapy on Depression in Adolescents and Adults with Substance Abuse, a Randomized Controlled Trial. This was written by Albornoz, and it was published in 2011. So for Article 2, the basic summary was the purpose of the study was to measure the effects of group improvisational music therapy on depression in adolescents and adults with substance abuse. There were 24 Spanish-speaking participants in the study, each randomly assigned either to the experimental group or to the control group. Before being randomly assigned, though, the participants completed the Beck Depression Inventory, also known as BDI, and the Hamilton Rating Scale for Depression, also known as HRSD, both which are used to measure depression levels. As stated by Albornoz, the experimental group received 12 group improvisation sessions over a 3-month period, along with the standard treatment program provided at the facility, and the control group received only the standard treatment program. From the study, the results were that the experimental group was significantly less depressed than the control group after receiving treatment, though the results were only significantly different when measured using the Hamilton Rating Scale for Depression and not the Beck Depression Inventory. So the type of design that was used for this study was, as quoted in the article, a pre-test, post-test control group design. It was a randomized control trial, which is a type of quantitative design. The independent variable was group improvisational music therapy, and the dependent variables were self-rated depression scores on the BDI and psychologist-rated depression scores on the HRSD. The study informs clinical practice by showing an added method to substance abuse treatment that could be utilized. Because the results of the study showed a significant difference in the depression levels of the participants when measured by the HRSD, the study could be utilized as a reference and a guide to using group improvisational music therapy on individuals who are suffering with substance abuse. And for the last and third article, the title of the article was The Impact of Group Music Therapy on Negative Effect of People with Co-Occurring Substance Use Disorders and Mental Illness. This was written by Garstrom, Bartkowski, Willenbrink, and Distelkamp, and it was published in 2013. For the summary, the purpose of the study was to explore the impact of group music therapy on levels of self-reported negative affect among men and women on a residential unit of an integrated dual diagnosis treatment program. This basically means that the purpose of the study was to measure the impact of group music therapy on self-reported negative emotions among the patients of a residential unit who were diagnosed with 2 or more illnesses, which included substance abuse disorder. The participants in the study were adults in residential treatment that had co-occurring diagnoses of both substance use disorders and mental illnesses. 20 group music therapy sessions were held at the facility, and the attendance of the participants was mixed. The 3 research-developed visual analog scales were used to assess pre- and post-session levels of anxiety, anger, and sadness. From pre-test to post-test, the results indicated that about a third of the participants who were involved in the treatment groups experienced a decrease in anxiety, anger, and sadness combined. Also, more than half of the responses in each of these 3 emotional states indicated a decrease. For the design of this article, it was a quasi-experimental design, which is a type of quantitative design. The independent variable was group music therapy. The dependent variables were sadness, anxiety, and anger. The study informs clinical practice by showing another method of treatment that can be utilized to treat individuals with substance use disorder, as well as with individuals who have a co-occurring diagnosis of substance use disorder and another illness, such as mental illness. The study shows that music therapy may be able to decrease the symptoms of anxiety, sadness, and anger, and to help people recover from substance use disorder, as well as decrease the symptoms of the other illness, in this case, mental illness. To compare and contrast these 3 articles, basically, all of these 3 articles dealt with music therapy and substance abuse and recovery, though each of these 3 studies focused on different aspects of substance abuse and recovery. The first article focused on withdrawal and craving. The second article focused on depression, and the third article focused on negative affect. Another similarity among these 3 studies is that they all utilized a quantitative study. The ways in which the quantitative design was implemented in each of these studies was different. The first article utilized a group-based, cluster-randomized, single-session waitlist design. The second article utilized a pre-test, post-test control group design with a randomized control trial, and the third article utilized a quasi-experimental design. In the first study, the research experiment was carried out well with an experimental group and a control group. But the fact that this was a single music therapy session was a limitation of the study. The results of this first study seemed to coincide with the expected outcome, which was to see a decrease in the withdrawal and craving symptoms of the participants, yet further research would be required since this was only a single music therapy session. In the second study, the experiment was well carried out, and both an experimental group and a control group were included. Also, the participants were randomly assigned to the groups, which helps to lessen research bias. Another aspect of the second study that worked was that the improvisational music therapy seemed to improve the depression symptoms of the participants, which could lead to improvisational music therapy being used in the treatment of those with substance abuse and lead to further research being conducted in this area. In the third study, there were surveys given at pre-test and post-test, which was good, but the surveys were not standardized surveys, but were created by the researchers themselves, which can create research bias. Also, another problematic aspect of the study was that there was no control group to compare the results of the experimental group to. As for future research. For the first study, one thing that should happen in future research is that future researchers should study how different types of music therapy interventions, besides lyric analysis, can aid patients on a detoxification unit from withdrawal and craving. Also, future researchers should measure, as quoted in the article, patients' engagement, level of commitment, and previous associations with music and determine if and how these factors might influence symptoms, motivation, help-seeking, stage of change, and relapse. For the second study, one thing that should happen in future research is that future researchers should conduct a pilot or exploratory study to look for patterns of client response to improvisational music therapy. For the third study, one thing that should happen in future research is that the future researchers should utilize a standardized measurement tool to add credibility to the study, since the measurement tool used in the study was created by the researchers themselves. Another thing that should happen in future research is that future researchers should collect data pertinent to each type of music therapy method used, in order to better understand the potentially distinct influences on affect. And the reason that future researchers should do this is because the data used for the analysis for this particular study were collected on different days, and a variety of music therapy methods were used for sessions on different days. So to have a coherent track of what each music therapy method did would then help to see the distinct influences that each type of music therapy method can have on affect. And that's it for my presentation. Thank you.